Omboko, Milemba.
Thank you, Honorable Speaker, for this chance to speak on this bill, which basically brings together and tries to create a database for the health sector. I think we also have this in education, because with NEMI system working, we are able to know the information on every student, and even movement of a student from one school to another is carried with information about him. And I think the world getting digital, we are taking this to the health sector. So this is a very important bill. And I see it going to bring out a number of things which are good for the society. Number one, it will bring to fore affordability in the health sector, so that there is the bit of sharing of information from one hospital to another, from one doctor to another. And above all, in this level of affordability, Honorable Speaker, to remove the double, triple, multiple tests that are being done on the patients from one hospital to another. A patient attending a hospital in a lower level will undergo the same test in the next level and will go continuously on the same test even at a higher level. And still at every level they pay. So this I see as a big advantage with this bill, because now a test at a particular level can be shared throughout the entire system of health. And then there's an advantage of a test at a higher level being shared across down to the CHV or the CHPs, the health promoters, so that even though they are working at the lowest level, at the ground level, handling the 100 people, we were told, they are able to enjoy the tests that otherwise were proven by the health practitioner at the highest level. And I find this very, very important, also given that the sharing of this information can be done across the counties and to the national level, and this will actually basically reduce the cost of health, which is a real burden. In the rural areas where we live, there's something, Honorable Speaker, called CT scan, which is now not only required, but is also proving to be a health menace, that every patient will be asked to go through a CT scan. And this CT scanning is done at every level. So for every CT scan, the patient pays about 7,000 to 10,000. And they are paid all through the way. I think this bill is trying to address that. Honorable Speaker, the sharing of high-level technical medical machines is also achieved. So we realize economies of scale in terms of the medical equipment that we have. That once we have a techno equipment at the Kenyatta Hospital, it can also serve people who are at different levels in different counties, and therefore the cost is actually shared. I also see further advantage being brought by this bill, that how often do we dream that we should get to the high-end hospitals like the Nairobi Hospital, get to Kenyatta Hospital and other hospitals that are at the high end. But with this shared information, it means that we can even share the doctors and their advice and their consultants from the very high end to the lower end level, to the ground level, and this will actually improve and actually bring down the cost of health in this country. However, Honorable Speaker, as we do all this in this bill, we must make sure that the health centers and health places, the hospitals, are equipped. Yesterday I was proud when I saw the CHPs, whom soon I would want them to be called health workers, because they are going to be a crucial part, integral part of the health system in this country. But that's a matter for another day. We need to uphold them to a working level and not just volunteers or promoters. And they got several equipments which will keep data, including the e-waste, the m-health, and the m-mobile. But you may realize, Honorable Speaker, that these same gadgets are not in the hospitals and the health facilities that we have around the country. So this must go concurrently with improving not only the medical equipment in our hospitals, but also the human resource in our hospitals, so that the hospitals can become the centers where these ground level health workers called health promoters will actually operate from and become their center of operation. Honorable Speaker, data protection has been spoken about as an important thing for this particular bill in order to protect the data protection of the people who will have gone through the system and how to dispose of the wastes in terms of data that will have gone into the system. But I also see further an advantage, and somebody spoke on this, I think it must have been one of the honorable members, that the research component that is being brought to bear by this particular bill is very good, because information will be there. And therefore we are able to discern the most prevalent diseases in this country, and also discern new diseases that are entering into the system and in the country or in the health sector, and take interventions which will actually handle them. And this is very good. So it will actually promote research. And when we shall be doing the third reading, the Honorable Chair, Bokose, who's just up here with me, we will need to actually see how we can also use this data so collected in order to give projections and also enhance research on the most prevalent diseases in this country and undertake the mitigations that are required to deal with them moving forward, Honorable Speaker. So prevalently and largely, this is a good bill that takes our health sector to another level. It is actually a blockbuster in terms of demystifying the health issues and creating space within the hospitals where we have so many files which are keeping equipment. We had this in several sectors, and now it's being removed so that we don't have many files. How many times are people in the villages told, go and buy a book? And I know most of you come from those areas where before you even start being treated, you are being asked to buy a book, and each time you approach a hospital, again you must buy books, simply because we are not digitized. So this is a blockbuster in terms of making this sector more efficient in order to assist the Kenyans. Honorable Speaker, I think with those very few remarks, I want to support the bill. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, Article 43 of our Constitution defines